Postoperative complications pose challenges for patients and healthcare providers alike. This guide explores wound healing intricacies, distinguishing primary from secondary intention, and investigates sources of postoperative fever. Additionally, it offers detailed insights into managing complications like wound dehiscence, evisceration, atelectasis, and postoperative delirium. Primary or first intention wound healing occurs in clean superficial lacerations where dermal edges can be easily approximated. This process involves simple bandaging, sutures, or stitches to initiate healing. Secondary intention wound healing is necessary when there is significant tissue damage and dermal edges cannot be mechanically approximated. This process involves more complex management, including drainage, gauze packing, and debridement, to facilitate granulation and natural healing. The primary distinction lies in the level of tissue damage and the ability to mechanically close the wound. Primary intention wounds are clean and superficial, while secondary intention wounds require more extensive management to promote healing. Delayed primary closure, also known as tertiary intention, combines aspects of both primary and secondary intention wound healing. It involves a delayed approach where the clinician waits for at least 48 hours before attempting closure. Initially, the wound is cleaned and observed for signs of infection. Once it is deemed safe, the clinician can proceed with suturing or closure akin to primary intention. The goal of delayed primary closure is to rule out any obvious infection and ensure the wound is adequately prepared for closure, thereby reducing the risk of complications such as wound dehiscence or evisceration. 1. Hemostasis. This phase involves the activation of platelets and the formation of a fibrin meshwork to stop bleeding. 2. Inflammatory phase. Characterized by swelling, pain, heat, and arrhythmia, this phase involves the influx of immune cells and growth factors for tissue repair. 3. Proliferative phase. In this phase, re-epithelialization, angiogenesis, vessel formation, granulation, scar formation, and wound contraction occur, utilizing the body's extracellular matrix and collagen. 4. Remodeling maturation phase. Collagen is organized and deposited, and the wound site undergoes remodeling. Identifying the sources of postoperative fever. Day 1 to 2, atelectasis or pneumonia. Day 3 to 5, urinary tract infection, UTI. Day 5 plus, venous thromboembolism or thrombophlebitis. Day 6 plus, wound infection at the surgical site. Wound dehiscence refers to a partial or total opening of the wound along suture lines and is often attributed to various risk factors such as inadequate suturing, ongoing infections, underlying conditions like diabetes, connective tissue disorders, or increased intra-abdominal pressure. On the other hand, evisceration represents a severe and relatively rare complication where the contents of the abdomen, including the viscera or intestines, are completely displaced. This condition is considered a medical emergency and requires immediate attention due to its life-threatening nature. To manage wound dehiscence, preventative measures such as applying sterile strips along the sutures and advising patients to refrain from lifting weights for the initial 2 weeks post-surgery are recommended to mitigate intra-abdominal pressure. Once dehiscence occurs, treatment involves meticulous incision care, promoting granulation formation, reapproximating suture edges, and administering antibiotic therapy if an underlying infection is present. Proper wound care and management play a pivotal role in preventing and addressing wound dehiscence, aiding in healing promotion and complication mitigation. In severe cases, collaborative efforts among healthcare providers, including surgeons, nurses, and wound care specialists, are crucial for effective management of this complication. Immediate action is crucial when addressing evisceration. Under no circumstances should attempts be made to manually push the exposed organs back into the abdominal cavity, as this can worsen the condition and pose serious risks. Instead, the exposed organs should be gently covered with a sterile, moist gauze or towel to protect them and prevent additional injury. Following this, the patient should be promptly transferred to the care of a surgeon. Evisceration constitutes a medical emergency necessitating urgent surgical intervention. Managing postoperative atelectasis begins with the removal of any secretions or plugs obstructing the airways. Bronchoscopy is a valuable tool for this purpose, enabling the safe extraction of blockages. To aid in lung re-expansion, a range of therapies may be utilized, such as physiotherapy, incentive spirometry, continuous positive airway pressure, CPAP, or mechanical ventilation, tailored to the severity of symptoms. A comprehensive approach to managing postoperative atelectasis is essential, encompassing both secretion removal and lung re-expansion to optimize lung function and facilitate recovery. Effective treatment often involves collaboration among various healthcare providers, including pulmonologists, respiratory therapists, and physical therapists, ensuring a cohesive and multidisciplinary approach to patient care. Postoperative delirium, marked by confusion and cognitive changes, is a prevalent and significant complication following surgery. Treatment typically involves administering haloperidol, an antipsychotic medication, to mitigate symptoms and restore cognitive function. Supportive care measures, including creating a calm environment, orienting the patient, and promoting cognitive stimulation, are essential adjuncts to pharmacological interventions in managing postoperative delirium. Collaboration among healthcare professionals is essential in managing postoperative complications. Surgeons provide expertise in surgical techniques and are vital in addressing severe complications like evisceration. Nurses play a critical role in monitoring patients, administering medications, and providing wound care. Wound care specialists offer specialized knowledge in managing complex wound-related issues such as dehiscence, an interdisciplinary approach involving surgeons, nurses, wound care specialists, respiratory therapists, and other healthcare providers ensures comprehensive and coordinated patient care. In conclusion, a thorough understanding of wound healing principles, such as primary and secondary intention and delayed primary closure, is fundamental for managing postoperative wounds and preventing complications effectively. Vigilant monitoring of postoperative fever's timeline and symptoms aids healthcare providers in promptly identifying underlying causes and implementing appropriate interventions. Early recognition and management of severe complications like evisceration and postoperative delirium are vital for minimizing adverse outcomes and promoting optimal patient recovery. The management of postoperative complications necessitates a collaborative, multidisciplinary approach, harnessing the expertise of diverse healthcare providers to deliver comprehensive and coordinated patient care.